The number of cases of dementia is growing, and it's actually a bigger problem than we thought.
Well, it's a bigger problem than we thought. The RAND study showed that 15% of the population greater than 70 years of age has dementia, and that the cost of care is between $41,000 and $56,000 a year due to the people not being able to care for themselves, and they need a caregiver, plus the medications that are currently being used. The big message to the listeners is how do we prevent this? I mean, what can you do as an individual to help prolong your brain health and brain function?
Talking with Dr. Al Johnson about dementia, the costs of treating dementia topping cancer and heart disease. Estimated 4.1 million Americans suffer from dementia. I did not realize, and you elaborated on it a bit, but that's the first I've heard that hypertension and diabetes contribute to dementia. And we all know that there's a huge problem with diabetes in this country.
Exactly. The high sugar content of many of our foods cause inflammation, and inflammation is what causes vessel disease. And I see people in their 50s and early 60s that are suffering signs of early dementia, where they have trouble paying their bills, or they aren't making decisions as they used to, or their personality changes, and you do an MRI on their brain with contrast, and you see they have small vessel disease. Besides the diet and the life change styles, I use hyperbaric oxygen to get oxygen to those cells in the brain to rehab them. And those are chambers, hard-sided chambers like they use for the bends and the scuba diving. We use them in medicine and help reverse tissue damage where oxygen has been deprived of the tissues, and in this case, the brain.
Dr. Johnson, how do people note those first signs of dementia? Like, for example, if you're approaching your 50s and 60s and you start to notice that you're being a little forgetful, is that it? Is that the sign that shows, hey, I am now officially at risk for developing dementia? Or is that just kind of like, when do you draw the line between I'm getting dementia and, I'm just being a little forgetful?
And that's a very good question. We tend to get data overloaded, and so we may forget things as we go along. But if you're having trouble, like in handling your money and paying your bills like you used to, or you see you just can't think through processes, multitasking is the biggest thing that we see first, where those executive functions kind of go. You aren't able to do things as quickly as used to. You have trouble in accomplishing those daily tasks. Or you notice you aren't as spontaneous and initiate things like you used to. Those are all early signs of dementia, mood and personality change. Then you really need to look into what's going on. Ask your doctor about getting an MRI with contrast. It's a common test, readily available. Outpatient facilities do it all the time. And if you don't have insurance, at least here in the Dallas area, you can get an MRI with contrast for $400. And if you're looking at your brain, hey, it makes sense to find out what's going on up there so that you can take some of these steps to really help improve it.
Now, you talked about diet and you talked about physical exercise. What about those mental exercises? I know now on TV you're starting to see websites promoting brain exercises. Do those work as well?
Those help. They really do.
Are you talking about the word puzzles and things like that? Okay.
Yeah. They help keep your brain sharp. But if you're having vascular dementia where you aren't getting blood supply and oxygen is the life of the cells, the life food of the cells, then you can do all those brain puzzles in the world and you aren't going to improve. So you got to make sure you cut down on the inflammatory processes in your body, get oxygen to your brain, which exercise does help, and then help rehab your mental acuteness with those brain exercises.
Is any of this reversible? If you have diminished brain function, can you all of a sudden, start making changes to your diet and kind of reverse this? Or is it one of those things where once you start traveling down that road, you're traveling down that road?
Oh, no, you can reverse it, and that's what I've seen in my practices. And they can go to Hyperbaric Centers of Texas and read about hyperbaric, where you actually change the cells and how they function. You put people in a chamber, increase the oxygen to all their tissues in their body, including their brain, and those brain cells recover. They've been damaged, they aren't working right, but they aren't dead, so you can get them to recover and function better. And I've seen people that have these cognitive dysfunctions reverse them, and it's documented by actually testing by a neuropsychologist.
Doctor of Internal Medicine, Dr. L. Johnson, if someone believes they may be suffering from dementia, or maybe more likely they notice some signs in a loved one, what should they do?
Assess what that person has. You know, is their diabetes controlled? Is their hypertension controlled? Get them on supplements like fish oil, B12, L-arginine, alpha-ketogluteric acid. Make sure their diet's a healthy diet, and then have their brain assessed, because sometimes there's other things that going on in their brain that causes dementia. You can have, brain tumors that you're unaware of. And then also, people are not making the adequate amount of serotonin and dopamine that help them have a good mood. So these foods that I talked about help with making serotonin and good brain hormones.
Dr. L. Johnson, thank you for your time this morning.
Oh, you're welcome. Excellent questions, and happy to talk.
All right, wonderful. Dr. L. Johnson talking about a new study finds dementia, the costs of treating dementia topping cancer and heart disease. An estimated 4.1 million Americans suffer from dementia, and of course the biggest cost associated with dementia, not so much the medicine, but the daily care